Welcome. I'm Les Flamer, founder of the Medicare Savings Network. I'm a senior too, and my mission is to help other seniors make good decisions and save money on Medicare supplemental insurance. In this, our first module in the Turning 65 series, I'm going to focus on the steps you need to take to get established with Medicare. I'll help you get organized, get you prepared to make good decisions, and provide the materials and information that will support an informed decision process. Our resource center contains lots of valuable materials, and I encourage you to explore it. You'll be able to download these slides for future reference, as well as other helpful materials like checklists, decision guides, and official publications from the Center for Medicare and Medicaid Services. Along the way, we'll point out gotchas, things that can trip you up if you're new to Medicare. Let's get started. First, don't wait to get started. Don't wait until you turn 65. You can actually sign up for Medicare 3 months prior to your birth month. Your initial enrollment period continues to 3 months after your birth month. That's a total of 7 months for your initial enrollment period. If you fail to sign up for Part B during the initial enrollment period, there may be lifetime penalties, but more about that later. But sign up now so you can get the benefits on the first day of the month you turn 65. How do you sign up? There are 3 ways. First, you can sign up by phone. You can sign up online at www.medicare.gov. But I think the best approach is making an appointment and visiting your Social Security office in person. Then you can also review Social Security records, get an estimate of benefits for you and your spouse, and make some decisions about when you want to begin receiving retirement benefits if you're not yet receiving them. Also, you'll be able to check your record to see if it's accurate, and you'll be able to correct any errors. Most people with an employment history qualify for Medicare Part A hospitalization insurance. Part A is free if you've worked 40 qualifying quarters throughout your work history. So how do you sign up? There's actually 3 ways. First, you can sign up by phone. You can also sign up online at www.medicare.gov. But I think the best approach is making an appointment and visiting your Social Security office in person. Then you can also review your Social Security records, get an estimate of benefits for you and your spouse, and make some decisions about when you want to begin receiving retirement benefits if you're not receiving them already. Also, you'll be able to see if your record is accurate, and you'll be able to correct any errors. Most people with an employment history qualify for Medicare Part A hospitalization insurance at no cost. Part A is free if you've worked 40 qualifying quarters throughout your work history. If you're disabled and under 65, Parts A and B are provided at no cost. If you do not qualify for Part A because of work history, you can purchase Part A. Premiums vary based upon quarterly work credits. The maximum premium for Part A is $422 per month in 2018. A spouse not qualified by work history can qualify at the age of 65 based on a qualified spouse's work history, provided the qualified spouse has reached 65. If the non-qualifying spouse is older than the qualifying spouse, the non-qualifying spouse does not receive Part A for free until the qualifying spouse reaches age 65. So that's a little bit confusing, but as an example, if the non-qualifying spouse, Mary, is age 65, and the qualifying spouse is Joe, and he is age 62, Mary will need to wait for Part A until Joe reaches age 65, or she can purchase it. Medicare Part B medical insurance is optional, and you do need to sign up. The standard premium for Part B is $134 per month for 2018. If you're receiving Social Security retirement benefits, it's normally deducted from your monthly benefit. High-income earners do pay a little bit more. If you continue to work past age 65, you would normally sign up for Part A. You may delay signing up for Part B if you have other insurance from an employer or credit union, provided that the coverage is creditable coverage. That is, the coverage is certified equivalent to or better than Part B coverage. You will receive a certification letter from the insurance carrier or employer describing whether the coverage is credible. If it's not creditable, you should sign up. For every year that you're eligible for Part B and didn't take it, there's a 10% penalty. This does not apply if you had creditable coverage and signed up during the special enrollment period. For example, if you did not have coverage for a 36-month period when you were eligible, the penalty would be 30% of the $134 monthly premium. That would add $40.20 per month for 2018. Keep in mind, this is a lifetime penalty. If you didn't sign up when first eligible, but had creditable coverage, you have an 8-month special enrollment period from the termination of coverage or termination of employment to sign up. If you do so during the SEP, there is no penalty. If you have limited income and resources, payment assistance may be available. There are a variety of programs that offer payment assistance. Medicaid is a federal state program that helps with medical costs for people with limited income and resources. It's best to contact Medicare directly to determine eligibility and determine what assistance you may receive. Medicare Parts A and B are often referred to as Original Medicare. We'll discuss the benefits and your costs in greater detail in a later module. Generally, Medicare pays 80% of the cost after the Part A deductible of $1,340 and the Part B annual deductible of $183 have been satisfied. You're personally responsible for the balance. A variety of Medicare supplemental insurance plans with benefits specified by Medicare but provided by private insurance companies are available. Medicare Advantage plans are another approach. MA plan members receive benefits from a closed provider network. They include the benefits of Original Medicare and other additional benefits. We'll discuss both of these options in greater detail in a later module. Prescription drug benefits are not covered in Original Medicare. They're provided separately under a Medicare prescription drug plan, often referred to as Part D, or incorporated as a part of a Medicare Advantage plan. Prescription drug plans are provided by private insurance companies and premiums vary. Each plan has its own formulary or schedule of drugs. Drugs are included on separate tiers and co-payments and co-insurance varies by tier. Typically, standalone plans have annual deductibles that range from $0 to $405 annually. Naturally, plans with no deductible have higher premiums. Many people who are healthy at age 65 and taking few or no prescription drugs fail to sign up for Part D. This is a big mistake since there's a significant penalty for failing to sign up when first eligible. It's very likely that as a person ages, the requirement for prescription medications will increase. The penalty is 1% per month for the number of months without creditable coverage times the national base beneficiary premium. The national base beneficiary premium is just an annual standard established by Medicare. For 2018, the national base is $35.02. If you didn't have coverage for 36 eligible months, your penalty would be $12.60 added to the standard premium for the plan in which you enroll. That's $35.02 times 36%. This lifetime penalty varies annually. For example, some prescription drug plans with a $405 annual deductible are available for around $40 per month. In this case, your monthly premium plus the penalty would be about $75 per month. Other plans with a zero deductible are available for about $72 per month. In this case, your premium plus the penalty would equal $107 per month. Let's review the big gotchas. 1. Sign up on time to avoid penalties. Part B is a 10% penalty for every 12 months without coverage. Part D, prescription drugs, the penalty is 1% per month for every month without coverage. Sign up early so that benefits begin the month you turn 65. Keep in mind you're eligible to sign up to 3 months prior to your birth month. Finally, think through what additional coverage you will need. More about that later when we discuss Medicare Advantage and Medicare supplemental insurance. Our next module will cover Medicare benefits in greater depth. Please join us so that you'll better understand exactly what is covered. Visit our Resource Center. The slide set is available for download so that you can use it as a quick reference. Other resources include official guides and checklists from the Center for Medicare and Medicaid Services, and we also have other helpful information. Thanks for joining us.